Good. All right, Miss Lydia, whenever you're ready.
The number of individuals in the United States who do not speak English or only speak limited English has risen in the recent decade, presenting a challenge to healthcare systems and increasing language barriers in American hospitals. So, what new technology is helping to minimize language barriers in American hospitals? Hello, my name is Lydia McRoy. Language barriers in American hospitals is not a new thing, but it has been on the rise as more people have come to America. According to the Migration Policy Institute, a Washington nonprofit organization that seeks to improve immigration policies through research, the number of people in the United States with limited English proficiency is estimated at about 25 million, up 80% from 1980. These language barriers often have fatal risk associated with them due to the possibility of miscommunication between patients and doctors. Failure to remove these language barriers in a healthcare facility can potentially result in life and death situations. In addition to these potentially fatal risks, language barriers between patients and physicians are often associated with repeated visits to the emergency center and longer hospital stays and an increased number and severity of medical errors. According to a report issued in 2015 by Boston-based CRICO Company, a leader in medical professional liability that protects the Harvard medical community, communication failures were identified in 30% of malpractice cases from 2009 to 2013. All these different languages make it difficult for there to be full efficiency in communication between patient and doctor. David Harrison, a field linguist that has been studying the Aka people of Palazzi, India, and advocates for the documentation and revitalization of lost languages, commented that different languages highlight the varieties of human experience. These multiple languages shape human experience and show us that no language is more important than another. Therefore, everyone, no matter their language, should receive a high level of patient care in a hospital setting. In fact, the denial or delay of medical care because of language barriers is discrimination according to the Civil Rights Act of 1964. Sadly, discrimination and racism still is found in hospitals today. In A Letter to My Nephew by James Baldwin, a well-known American author, playwright, and activist, it gives a message about the importance of love and a quest for racial equality and an end to discrimination. Baldwin is communicating to his nephew about the importance of understanding one another, which is what must be done to overcome language barriers in hospitals. Whether true discrimination or not, it is a fact that the delay of medical care due to language barriers can cause medical issues. One example of an extreme case of language barriers would be the death of a 9-year-old Vietnamese girl caused by the reaction to the drug Ritalin. The records show that no competent interpreter was used throughout the child's encounters with the medical system. Instead, the patient and her 16-year-old brother served as interpreters. The hospital's failure to provide a medical interpreter and address the language barrier was a substantial factor in causing the girl's death. Nationwide, hospitals are experiencing an increasing need for medical interpreters as the number of people with limited English skills increase. To meet this need, hospitals are relying more and more on technology rather than in-person interpreters, partially due to the cost-effectiveness of the technology. Inadequate funding of the language services limit how much money is spent. However, the money that is spent has gone towards telephonic services until recently, where new, better technology has come out. Internet chat technology is taking the service to mobile devices and to video. This service will provide more direct communication between patient and interpreter. The patient will actually see someone talking to them in their own language and be able to communicate with them. This service is cost-effective when compared to the 2-hour minimum charge of $60 to $70 for an interpreter to come to the hospital and interact with the patient. Mobile communication and video remote interpreting can provide a cheaper and easier way. These communications and processes are able to keep marginal costs lower by eliminating the wasted test, provider time, and by even moving patients to more appropriate care settings for their needs. Along with internet chat technology, another option that decreases language barriers would be the use of smartphones to create an integrated healthcare system. Integrated healthcare refers to an approach with a high degree of communication and collaboration between healthcare professionals. This smartphone approach can shorten and simplify medical tasks, making them more effective. Glens Falls Hospital, one of the biggest hospitals with 29 regional healthcare centers, has started to address language barriers by implementing video remote interpreters. In a matter of seconds, this video remote interpreting system is able to connect patients with medically trained and certified interpreters that can be accessed on multiple devices like iPads or portable carts. Another program used to lessen these language barriers is a service called Stratus, which connects clients with interpreters in over 175 spoken and signed languages in less than 30 seconds. Overall, there are many types of technology available to minimize communication issues in hospitals, but some issues do arise with this new technology. The big switch from using face-to-face interpretation to using technology includes many positives, some of which are lower cost, fewer medical errors, and more efficiency overall. However, losing that face-to-face contact with interpretation could also mean losing a personal aspect of healthcare, which patients still value today. Also, if new technology was put in place, the doctors would have to be educated on how to use it, which could cost money. And providers could be resistant to using the new technology because of their comfort with the current technology and their own mobile devices. New technology and ideas could be made better and more effective on a larger scale. Therefore, a solution could be to create a standardization of similar services that use video remote interpreting in an integrated healthcare environment on a national level. Proper legislation would have to be passed in order to implement this on a national level, and there has to be some type of funding to cover the cost of the new technology. There could also be hospitals that do not want to adopt the new technology system. It is possible to overcome the language barrier in hospital and improve communication. The answer just lies in technology. Thank you.
All right. How valid and reliable are the sources you used, and how do you know?
Okay. So all the sources that I used were from EBSCOhost. I used them because all of them were done as like a research project, whether they had some sort of implementation. For example, the Glens Falls one, that one was research done about how the video remote interpreting from the hospital, what the implementation caused, and like how it started. There was one source, however, that I did have to do a pace sheet for, but it was reliable. It wasn't biased, and it was done by, I think, the thing that I talked about, the Harvard medical community.
Okay. And let's see. What advice would you have for other researchers who were considering your topic?
I would advise them, just because all this new technology, it's kind of been hard to see the true implementation because it hasn't had a lot of time. Like, we've seen the direct implementation, but we haven't seen the long term. So find something or find a hospital that has had a longer time to see where this technology, if it actually is good. Look at more of the pros and cons of it, and then come to a conclusion and a solution.
All right.
Based on that.
Thank you very much.